Good afternoon, everyone. Thanks very much for joining us. My name is Dawn Hansen. I'm the Executive Director of the Bulkley Valley Research Center, and we're really pleased to have our participants and our presenter, Chelsea Pelletier, at our virtual seminar series today. I'd like to acknowledge that we are gathered on the traditional territory of the Gitumden clan of the Wet'suwet'en Nation. I'm hosting today from Telkwa on the bank of the Bulkley River. Just a quick reminder that this session is being recorded. Please don't hesitate to be in touch with me if you have any questions or concerns. And our question and answer period at the end, I'll moderate that, and we can have questions through the chat, or you can unmute and you're welcome to ask your questions directly to Chelsea. I'd like to thank our community sponsors who help fund the seminar series, the Bulkley Valley Community Foundation and the Bulkley Valley Credit Union Community Fund. It takes a bit of time to coordinate and to host. It's very worthwhile, but some extra funds to support that process is always greatly appreciated. And without further delay, I'll like to introduce Chelsea Pelletier. Dr. Pelletier is an associate professor in the School of Health Sciences at UNBC. She has an emerging research interest in working with stakeholders to understand the health and well-being of wildfire fighters. And we've been looking forward to this presentation from Chelsea on occupational health impacts. Thanks, Chelsea. Go ahead.
Thank you so much, Dawn. Thank you for the invitation to present today. So I'm joining you from Prince George today, which is the traditional unceded territory of the Lheidli T'enneh. And I'm excited that, again, we have this opportunity to meet coming from all different parts of the province. So thank you for joining us today. I also want to add that I'm very much a health researcher. So when I was first invited to talk, I was a little apprehensive because I wasn't sure I would be able to present something that would be applicable or interesting to people with more of an environmental science background. So please let me know if something I say is too jargony or doesn't make any sense. I've tried to keep this fairly high level, but don't hesitate to ask questions if something is not clear. So I also thought it would be worthwhile to just review some of the language and orient everyone to what I'm going to be talking about today. So first, I'm going to be focusing on the occupational health impacts of wildfire. You may hear of other health impacts of wildfire as it impacts the public. So those are what we consider like the public health effects of wildfire. And this may be health outcomes seen in communities that live close to somewhere where there is a large fire. And most of us, if we live in the north, have probably spent a summer or two exposed to wildfire smoke. And so that is interesting to study, but it's not the focus of this talk. So I'll be focusing on the occupational health impacts, so studying how wildfire impacts workers who are engaged in fire suppression. And that includes people who are frontline firefighters, as well as some related personnel. So you'll also potentially hear different terms for wildfire. You may also hear wildland fire or forest fire. They all more or less mean the same things, but different jurisdictions will use different terms. I've tried throughout this presentation to stick with wildfire, just to be consistent with the British Columbia Wildfire Service. And then within there, we would have wildfire fighters, wildland firefighters, forest firefighters, or fire rangers. Again, those are terms that all essentially refer to people who work on the front line in fire suppression efforts. And typically, firefighters will work on a fire line more directly exposed to smoke. The related personnel, which I always think is important to acknowledge, and we've tried to include that in some of our work, and I'll get to some of the limitations of that later on. But this is just, I think, important to acknowledge there are other people who work in logistics, operations, management, air support, that all are involved in fire suppression activities and do experience some exposure to wildfire and hazards associated with their work. So why is this kind of important to study? So just to sort of set the stage a little bit. So we know there's increasing wildfire activity globally. There's many drivers for this. One, of course, is climate change. And because of this increase in fire activity, there are more workers engaged in fire suppression activities. So as we have more workers engaged, it becomes increasingly important to understand the potential occupational health impacts. The health impacts associated with structural firefighting, so people who work, sometimes it's called urban firefighting or work for city fire departments, are actually fairly well researched. But there's really not the same amount of knowledge or understanding of the impact of wildfire smoke. And historically, it was viewed to be less harmful because it's, just wood burning. It's out in the woods. It's not as harmful as the structural firefighting or structural fires. However, now we're starting to realize that that may not actually be true. Another reason it's important to study is that wildfire fighters actually wear fairly limited personal protective equipment, or PPE. And there's many reasons for this, and I don't profess to be an expert as I'm not a firefighter myself. But part of that is because of the nature and physically demanding aspects of the job. So it's challenging to then develop effective and wearable PPE for wildfire fighters. And so compared to structural firefighters, because we don't have as much information, and because it's a very different nature of work, there's not the same PPE worn by wildfire fighters. So some of the potential exposures, again, for wildfire fighters, one, of course, the most obvious is smoke itself, so wildfire smoke. And there may be people here that are better experts on the chemical composition of wildfire smoke than I am. But the key ones we consider for health outcomes are particulate matter, and then some of the other potentially carcinogenous toxins, and carbon monoxide is another potential compound in wildfire smoke. Particulate matter, specifically, especially very fine particulate matter, can get lodged deep in our lungs, and that's what can contribute to respiratory disease or decrease in lung function. But I also think it's important to consider the other potential hazards or health risks associated with wildfire fighting. So while smoke is really the obvious factor and respiratory health is the obvious sort of low-hanging fruit, I also think it's important to consider mental health and emotional health, as well as the workplace culture and the culture and structure of the work. And so typically wildfire fighters will work on a fire line. Oftentimes when there's a big fire, there'll be a fire camp erected somewhere near the fire. So this was an example in 2017 where we were fortunate to go collect some data at the Williams Lake Airport fire camp. And so during that time, people are away from their homes, potentially for 14 days at a time, living in a fire camp, potentially sleeping in a tent. So it's unpredictable. It potentially takes people away from their homes for long periods of time. There may be some traumatic long shifts, stress that can accumulate, and it tends to be quite a transient workforce. So the wildfire service hires a lot from universities. So there's a lot of university students who work as wildfire fighters in the summer. So it can be hard to track them. And it also creates a different set of risks when people are engaged for potentially short periods of very high intensity work. So just to give you an understanding of how complex it is to potentially understand the health impacts beyond simply looking at smoke exposure. So the project I'm sort of going to summarize today really aimed to look at and understand what we know about the health of wildfire fighters. And I won't bore you with the details of the search that we conducted, but it's what we call a scoping review. And so it's a systematic way to search academic literature. And we also included evidence from reports from different government organizations, and things that we could dig up mostly online. And so through that search, we wanted to understand what we currently know about the health impacts of wildfire for wildfire fighters and people who work doing related jobs. And if there were any mitigation strategies, or things that had been implemented to help reduce that risk. And so I'm going to present some of the key evidence from the main categories. So the respiratory health, cardiovascular health, some things related to inflammation and oxidative stress, mental health, and then fatigue and sleep. So we tried to categorize the evidence on these large categories. And then I'm going to touch on briefly the second phase of this project, where we wanted to find out where should we go next and what research questions should we ask. And to do that, we conducted a priority setting project where we talked to stakeholders. So we talked to workers and to find out what they actually felt was important and what their concerns were. So when we think about respiratory health, in general, we're looking at changes in lung function, changes in lung capacity, or certain symptoms. So again, those of us who've probably experienced some wildfire just in our community, you may notice that your eyes kind of burn a bit. It may sort of burn when you breathe. You may develop a bit of a cough. So those are all the symptoms that we can also measure. Typically, lung function is measured with spirometry or a breathing test, where essentially you're required to take a maximal, really large inhale and then exhale forcefully. And we can measure the total capacity of your lungs. And we're also interested in the speed of which you can exhale that air. So the literature tends to show, and what we tend to see, is that there's a decrease in lung capacity of some measures over the period of a single wildfire season and a single shift. So a wildfire season in BC would typically span, we'd want to do pre-testing in April until September or so. And a single shift, I'm talking like morning and night at a fire line or at a fire camp. And so we tend to see fairly consistently that forced expiratory volume in 1 second. So that's the amount of air that can be exhaled in 1 second, and tends to be a fairly strong clinical indicator of obstructive pulmonary disease or pulmonary restrictions, tends to decrease in those sort of time periods after a single season. There also tends to be an increase in respiratory symptoms after a single season. And there's some evidence to suggest the change is task specific. So depending on the role or job an individual has on the fire line, the impacts on their respiratory health and the exposures may slightly vary. So again, there's some potential health impacts of exposure to wildfire smoke. However, I think there's several important caveats to consider. One is that it's very hard to compare across jurisdictions because fire seasons are all very different and they're completely unpredictable. So we don't really know the dose response. So we can't really tell you if a certain amount of exposure is okay, at what point people will start to see a decrease in some of these lung function measures. We also don't know how it potentially manifests into lung disease. So we don't know if it eventually could lead to increased rates of asthma or COPD, because there's no studies that have evaluated these changes beyond a single season. So there is the potential that people recover their lung function after one wildfire season in the winter when they're not exposed, their lung function again recovers. Because most people who work, especially as frontline wildfire fighters, typically they're relatively young, relatively healthy. So a small decrease in their lung function may not necessarily bring them down to a point where we'd be concerned, or it would be sort of considered clinically significant or indicative of a disease. And it's also then possible that they then recover that function after a single season, but we really don't know the impacts of cumulative seasons of exposure, or if that actually leads to increased disease. In terms of masks and potential PPE for respiratory exposure, there's really only 2 sort of small scale studies or projects we found that looked at it. They did find that, particularly with a mask with the right filter, because like I mentioned earlier, we don't necessarily know a mask that's effective at preventing exposure to wildfire smoke or all of the compounds. But even if not worn for a whole shift, there was some potential benefit at reducing exposure. Although I think there's a lot of really important considerations about the wearability and comfort and applicability of wearing a mask during long, pretty strenuous wildfire tasks. I also just think because of COVID, the whole conversation around masks may now rapidly change as masks have become a little bit more mainstream. But currently we're not really at a place from a research perspective where we can make a strong recommendation about that. So for cardiovascular health, we tend to look at or consider general functioning of the heart and blood vessels. Typically, this would be measured through things like blood pressure, heart rate, blood cholesterol levels. And these things are all indicators that can be used to understand the development of different cardiovascular diseases. So hypertension, which is high blood pressure, or heart disease. And so there's not actually a lot of research on cardiovascular health outcomes in wildfire fighters, certainly not as much as respiratory health outcomes. There is some evidence to suggest in sort of cross-sectional association studies that particulate matter is associated with arterial stiffness and some other measures of vascular function. And these can be predictive of things like the development of atherosclerosis, which is hardening or plaque formation in the blood vessels. Again, we don't actually know, there's not like really longitudinal studies to know if the risk is actually increased substantially of disease endpoints. Also, some, again, an association between wildfire fighters having slightly higher rates of hypertension than the general population. And then some other studies which have actually shown an increase in cholesterol after a season of wildfire fighting. Again, without that longitudinal long-term data, it's hard to know how that impacts on long-term health status. So again, we really aren't clear how it impacts disease risk after a career or multiple seasons. And most of the studies, especially in cardiovascular health, are cross-sectional association studies. So they look at sort of a single time point rather than measuring a change. So inflammation and oxidative stress. So inflammation is typically measured through biomarkers in the blood. So interleukin or IL-6 and C-reactive protein are a couple common ones. Elevated inflammation or these elevated markers in the body can indicate there's some degree of inflammation in the body, which means your body's, fighting an infection or an irritant of some kind. And long-term, having elevated levels of inflammation can potentially be indicative and lead to cardiovascular disease or cardiometabolic disease. Oxidative stress is essentially our body's inability to deal with reactive oxygen species. And it is important because it can lead to or is associated with tissue damage and death and DNA damage. So often it's implicated, oxidative stress would be implicated with the development of cancer commonly. And so one thing that's studied in fire is exposure to polycyclic aromatic hydrocarbons. So we do see that there's a general increase in inflammation after exposure to wildfire. This is found both in the airways and systemically, which isn't necessarily surprising because wildfire or smoke is a bit of an irritant. Again, I'm not sure any of the long-term health outcomes of that. Polycystic aromatic hydrocarbons are also been associated with respiratory exposure to smoke. So even up to 2 days later, suggesting there may be some long-term residual impacts that remain sort of in the body. And usually these are measured through a urine test as well as dermal exposure, so from soot and within the smoke. So there is been a small study that was actually done in BC in 2019 that found that additional hygiene measures, so having people shower after their shift and washing their uniforms, as well as wear the mask for part of the shift, actually reduced exposure to hydrocarbons. Again, a fairly small study, but suggesting that there are strategies that can be used to reduce exposure. So for mental health, we tend to look at emotional, psychological, and social well-being. So these can be measured again as factors or changes in mental health, or there can be specific outcomes or diagnosed conditions like anxiety, depression, PTSD, and general life satisfaction. So there's not really any long-term studies looking at mental health. And I feel like I'm starting to sound like a broken record because there's really no long-term studies on any health outcome in wildfire fighters. Some studies have shown that PTSD is fairly common in wildfire fighters and remains even after a disaster. I do think it's important to consider that PTSD is commonly studied in first responders like police or structural firefighters, but I'm not really sure how it's operationalized yet for wildfire fighters, where the trauma and exposure to stress is slightly different. And I don't know that that's essentially been evaluated yet, but there is some potential link there. And there seems to be some evidence that the intensity of the disaster may be associated with the psychological impairment. So for fatigue and sleep, we've kind of grouped them together, but I think conceptually it's important to consider that they're distinct concepts. So fatigue is sort of a general alertness, often measured related to cognitive fatigue, the ability to make decisions, things like reaction time, versus sleep is the sort of quality and quantity of sleep that we each obtain regularly, hopefully. And so inadequate sleep can contribute to fatigue, but it's sort of important to study and understand both as well. So we tend to see, probably unsurprisingly, general reports of fatigue and increasing fatigue with long duration shifts and long work tours. So at the end of sort of one long day of work, but as well as after the sort of compounding of 14 days of work. And typically firefighters would work 14 days on a large fire and then receive a 3-day rest period. And some studies have shown that even in that 3-day rest period, it may not completely recover, or it may not be a complete recovery of that fatigue. Again, each fire season is very different, so it's very challenging to really understand if there's, again, any sort of dose response or any optimal cycle of work to rest at this point. There's also general reports of decreased sleep quality and quantity in the field. Again, probably not that surprising, but I think it's important to consider that during long, hard physical tasks, how to potentially improve the quality and quantity of sleep that people, or rest time that people are able to receive. And that goes for wildfire fighters, but I think also people who work in management tasks or the incident management teams who are making decisions and controlling these sort of large fires and directing a lot of people, to also consider the amount of rest that they are able to receive. So again, it's not clear if there's long-term health impacts, if this chronic fatigue manifests over a season, how long it takes to recover, how it may then link to things like mental health outcomes or chronic stress, and if it has sort of impacts on cognitive performance, and if 14 days is maybe too long and people shouldn't work that long, or they have challenges making appropriate decisions. I mean, we really don't have any sort of answers based on that. And again, I think the sleep quality and quantity may not be ideal. That's not as much of a research question as much as I guess an operational consideration. And I think there's some considerations in thinking that potentially could go into deciding on the work shift cycle. So how long is a shift? How many days do people work in a row? How long do they get off? And things like that that really could be better studied to potentially address these concerns. Okay, so where do we go from here? So I just dumped a lot of information on everybody. And certainly the process of doing this review was a lot of information. And we have a lot of just endless gaps in knowledge, I think, right now. So the question was always, where do we go from here? And what should we give priority to really help to address and better understand some of these issues? And so I personally think the best way to find out is to actually talk to people. So talk to people who have firsthand experience. So we conducted a project to look at the research priorities, and we wanted to find out what the stakeholders thought. So what people who work in wildfire actually thought. So we included people who were current or former wildfire fighters, other BC wildfire employees. So again, that would include anyone who works in sort of management, administration, logistics, and some researchers. And we did a two-stage survey, one where people were asked to just list what they thought were the research priorities, and then we analyzed them. And then of the top 10 that we identified, we asked people to then rank them. So we could come up with a prioritized list. And then we did some interviews to sort of contextualize the findings, discuss appropriate health concerns or the important health concerns people had about their work, and to identify some specific projects. Just because it's very hard to know certainly where to start and what to prioritize. So this graph shows the sort of the findings from our ranking activities. So I'll walk you through it. So we ended up with 10 research topics or research priorities. So smoke inhalation and respiratory health was definitely the most commonly stated and indicated. Fatigue and sleep, mental health, stress, work structure, which was actually fairly closely related to fatigue and sleep and included things like the number of shifts on versus off, the scheduling, things even like communication within the workplace. And then long-term risk of disease, which was closely related to things like long-term risk of developing cardiovascular disease or cancer, nutrition, fire camp conditions, the risk of sort of acute injuries, and physical fitness. And so we asked people to rank these, and we determined sort of consensus when at least 70% of people indicated a priority was extremely or very important. And so you can see we had about 5, maybe 6 that were considered sort of important or that we had somewhat consensus on, for that we should study it sort of more in depth. And so from there, we took these priorities and we talked to people and we asked them what they thought was important and what we should study within these topics and why it was important to them. So I'll share a couple of the quotes and a couple of the things that people told us, because I think it really gives some depth to these research topics and humanizes the actual concerns people have. So related to smoke exposure and respiratory health, people talked about how they wanted to know what kind of risk and what kind of exposure they were seeing and how it was potentially impacting their health. And they wanted to know a little bit more about, a mitigation strategy. So what could they do, or what could the BC Wildfire Service do as their employer to help protect their health? So, some people just identifying that after a fire season, your lung capacity is not what it was at the beginning. And so wanting to understand how that impacted their health. And then thinking about other strategies. So it would take a while to find the right mask, and in particular to get the buy-in from everyone to wear a mask. just because of the nature of the work. So potentially looking at different kinds of strategies, mitigate the risk in different ways. So some things that are talked about are even where you put your fire camp in terms of smoke exposure. Maybe people have to rotate more frequently on the fire line in terms of the tasks they're doing. Related to the long-term risk of disease, again, there is some overlap with smoke exposure. So the long-term exposure to smoke and particulate matter, and what is sort of the health risk. So what might they be being exposed to? And then again, the long-term risks of even things like lifespan. People start often when they're young, so maybe they're 18 when they first start. And then how does that impact their sort of health overall across their lifespan? And again, really right now, we don't have any solid answers to that question. And then fatigue and sleep was about sort of the quality of sleep, but also the length of shifts. If people are able to get sort of quality rest, that they're recovered and able to work the next day, and how that impacts their safety while they're working and sort of that decision making ability. And then also the short-term fatigue, but also how that accumulates after a season, and is the off time enough time to recover? Because while some people are seasonal, there are people who will work all year, and do they have enough time also to recover from a very busy fire season? And then mental health, again, the season ends, and oftentimes people then start to feel potential mental health impacts, and it kind of sets in, is how some people kind of explained it. So again, understanding more about what the long-term impacts on mental health are, and how it carries even beyond a single season, I think was more or less the theme of a lot of these interviews. And then stress, again, what are those sort of long-term impacts of chronic stress and chronic exposure? In particular, I mean, 2017 and 2018 were two very busy seasons in BC. And so is there a cumulative impact on stress? And I think also important to just expose and compare against seasons that were less busy. So like 2020, which may have imposed different sort of mental health and stressful conditions or burdens on people because they weren't able to work to the same extent that they had in previous years. So some overall conclusions, I think, and next steps. So we see some short-term impacts of wildfire for wildfire fighters, short-term impacts on their respiratory function, cardiovascular risk measures, and I would include inflammation sort of in there, and on fatigue. So when I say short-term, I mean both before and after like a single shift, as well as a season. Of course, again, it's challenging sometimes to compare with different countries because their seasons are different. But roughly a season, I mean, in BC would be roughly the summer months. So that sort of time period. But again, we don't know what happens after multiple seasons and if it's cumulative or if people recover in between. So I think that's kind of the key priority, is that there's really no long-term data on health risks. People identified as a priority, and it was a just very obvious gap in the literature and in our collective knowledge that we identified. And then to see if that impacts disease endpoints. There's lots of difficulties in doing this work, of course, because of the unpredictable nature of a fire. We have no idea where and if there will be big fires every year. So actually looking and examining these changes in health status is quite challenging, just because you sort of have to be ready, but you don't know if it will even happen. And I think I see Mike is on the call. So one of my graduate students, Mike Eady, did a study in 2017, and we were set to look at respiratory health. Actually started in 2016, but there wasn't a big fire for him to go and measure changes in respiratory health, and the season started early, so we had challenges getting baseline data. There's a lot of research challenges that make it really hard to get solid data and solid understanding of this sort of dose response, and to actually track how it impacts people's health. And I think it's also important to consider worker realities and the practicalities of some of this work. It's not always fair or right that we go in and do research. So there's a lot of limitations in the field of research, but there's lots of reasons for that as well. And then I also think it's really important to consider the impact of different roles. The vast majority of research and knowledge is related to people who are wildland firefighters or on more of like a frontline fire suppression role. But I think there's also lots of considerations for people who work in other roles related to BC wildfire or related to fire activity or fire suppression. So I just want to acknowledge the great team involved in this work, and also particularly the BC Wildfire Service, who are very great partners, and I'm very proud of the relationship we formed. In particular, Mike McCulley and Natasha Brodsniewski, who are from the Research and Innovation Program. And then as well, all of the participants. I've worked with a lot of different groups of people doing research in the past, and I've never found a group that is more enthusiastic to participate in research than wildfire fighters. So I thoroughly appreciate that. And the funding for most of this work was provided by the British Columbia Ministry of Forests, Lands, Natural Resources, Operations and Rural Development through the BC Wildfire Service. So I'm happy to take some questions. It seems we have a fair bit of time. And thank you so much for listening.
Thanks so much, Chelsea. That was really super informative, and looking forward to hearing what's next for everybody.